Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of June 14th, 2023. This week, I'm addressing the question, what are the health risks from the wildfires? Well, obviously, there's direct impact from the fire, impact from the smoke on your health, and the question about what this means for the future. Is this a harbinger for the future? In terms of the direct impact of fire, obviously, fire is tremendously dangerous. I don't have time to go into it. If you look at the number of deaths from fire in the United States over the last 50 years or so, you'll see that it was coming down, all deaths in light blue and house fire deaths in green. And then in the first part of the 21st century, it seemed to have leveled off. And then in the last 10 years or so, it's been coming back up with a widening gap. So fire remains a significant cause of death in the United States. But right now, most people, tens of millions of Americans, are concerned about the impact of this wildfire smoke on health. It's been widely covered in the news. Many cities are seeing the highest rates of air quality contamination that they've seen. Obviously, much of this is from uncontrolled fires in Canada. These fires are producing tremendous amount of smoke. And just today, there's reports now of another wave of smoke coming in over the upper Midwest. So obviously, everyone is at risk from wildfire smoke, but especially older adults, pregnant women, children, folks with pre-existing lung and heart conditions, people from lower socioeconomic groups, and folks who are forced to work outside. And there are, of course, the usual things that we would all get if you sit next to a campfire. You know what all of these symptoms are. But of greater concern is the elevated risk of heart attacks, strokes, emergency room visits for asthma, COPD, and all-cause mortality. And importantly, it appears that increased risk from this exposure can last for years. Recent reports have also suggested that wildfire smoke may be associated with increased risk of lung cancer and even fungal infections. And all of these risks may be increased by repeat exposure. Of particular concern is the effect of wildfire smoke on pregnant women. The smoke exposure in pregnancy can cause pregnancy loss, low birth weight, and preterm delivery. Well, is this a harbinger for the future? Are we going to expect to see more wildfires and wildfire smoke in the future? And the answer is, unfortunately, yes. A recent article, in fact, as you'll see, it hasn't even come out in print yet, but it came out last week. And it said that wildfires are increasingly damaging. They burn more than double the acreage per year as they were decades earlier. In the 90s, 3 million acres were burned a year. Last year, 2 years ago, it was 7.1 million acres. And they say that projected wildfire trends in our country predict increasing risk of exposure to smoke because of increases in weather and climate-related factors. So yes, this is going to be a common issue in the future. Some people are even talking about the smoke age or the heat age, like the ice age, that we're going to be entering a time where this will be increasingly common. So that raises the question, what can we do? Obviously, if you live in an area where there's a direct risk of wildfire, so it's not the smoke you're thinking about, but the fire, please prepare in advance. Know in advance where you can tune for local information. Explore the various ways you have of exiting your location. Or is there only one road out, or are there others? Obviously, put together a go bag for you and your family, include medication, food and water, of course, key phone numbers, but also for your pets. Don't forget them. Don't leave them behind. If you have to leave them behind, please don't leave them tied up. And consider relocating prior to the evacuation. If the fire is getting reasonably close and they have you on warning, you may want to go ahead and evacuate. But if you don't evacuate in advance, when you do get the word, please go. Don't take the chance. Folks will tell you that if you put your fate in the hands of other drivers on the road during a wildfire, the risk is significant. In terms of those tens of millions of Americans exposed to wildfire smoke, they say they recommend staying inside in a windowless room or in a room with windows closed. If possible, use a high-efficiency filter in your air conditioning system or a portable air cleaner. If you can't take those steps, consider finding shelter elsewhere. And if you do take those steps, don't burn candles, cook, run a fireplace, or anything else that's going to add to the smoke in the room. If you do have to go outside, minimize the time that you're outside, avoid the smokiest times of day, wear an N95 mask, the same one we talked about during COVID. And if you have to evacuate, close the car windows and vents and run the air conditioner in recirculate mode. And obviously, as always, seek healthcare immediately if you have shortness of breath, chest pain, or other serious symptoms. But there's one other thing we can do. By the way, I apologize. This is a flyer from the EPA. If you want to pause and read this, it's basically the same things that I've just said. There is one more thing that we need to do, and that is no matter where you live, understand that the risks of wildfires will almost certainly continue to increase, exposing a greater number of people to both the direct, that is the risk of fire, and the indirect, the risk of smoke from the wildfire. We have to understand that politics aside, climate change is something that we have to address. When we were kids, Smokey Bear said only we can prevent forest fires. Well, it's still true today, though now it's more about climate change and changing the direction of the increasing heat and all of the other weather changes associated with climate change. So yes, the risks are obviously the direct impact from fire, the impact of smoke on our health, and the realization that if we don't do something about this, it's going to continue to get worse in the future. Please feel free to share this video or any of the other videos in this series with anyone who might be interested. We're happy to add folks to our mailing list. As always, I have researched and prepared and presented this data. I am solely responsible for the content. Gary Young has produced, edited, captioned, and posted the video. If you have any comments about this or any other issue, please let me know. I look forward to hearing from you. And next week, I'll get back to the series on oral health. Until then, please be well.